So now we're going to look at the superior tib fib joint. Part of our functional weight bearing tests, go ahead and cross your arms, is this rotation towards me. We already looked at mobility of the hip in the TL junction. What's left is to look at the ankle in the superior tib fib joint. So come back forward. In a normal superior tib fib joint, when I palpate the head of the fibula in the tibial tuberosity, and when she rotates towards me, she's going to be moving anterior lateral, and my fingers should come closer together. When she rotates away from me, so go ahead and rotate the other way, she's going to go posterior medial, and my fingers should separate. So go ahead and rotate again towards me and away from me. So she has some motion, and you can kind of feel that joint under my finger. It's making a little noise, but that's okay. Nothing wrong with that. If I felt there was a restriction, I would compare it to non-weight bearing. So go ahead and lay on your back. And in non-weight bearing, and you have to be careful on how, because remember the nerve is right behind here, you want to take up some of the soft tissue, get on the superior tib fib joint, and bring it anterior lateral, posterior medial. And see how it moves. And you compare to the other side to see if it moves. Actually, you move more on this side compared to this side. So she moves less on this side compared to the other side. Now we have to piece that together. Remember, the fibula, when she's turning towards me and it's moving anterior lateral, the inferior tib fib joint is working as well because it slides back and forth in weight bearing. So we want to make sure we appreciate the lower part of the tib fib joint eventually once we get down to the ankle, but realize it's a joint that works in harmony with each other, just like the TMJ works in harmony. It's separated by an interosseous membrane.